One of the things that we sort of pride ourselves on is the health and well-being of our volunteers and our members, and we decided to go for Quality for Health because it was a bit of a sort of fact check for us to make sure that actually were we doing those and meeting those, but actually what I wanted to do was also identify gaps. So we knew that there were certain things that were doing very well, but sometimes when you're in the project you almost sort of can't helicopter up and see yourself from other people. So this was an opportunity for us to be looked at from the outside, and actually it was really helpful because the Quality for Health has certain areas that you have to meet and certain criteria that you have to look at, and what it did was allow us to sort of do an internal assessment of ourselves. There were bits where we thought actually we can do better at this, or we can introduce this to make it better. One of the things that we did was we sort of reviewed our induction for volunteers. One of the other things that we did was introducing healthy welcome packs for our members. So we already had a welcome pack, but it was quite thin, and what we did was we reviewed that and said actually we could do, like, we had a sheet in it around falls prevention, we had a sheet around what other services that could help them. So even just little things like that can make a big difference. When you sign up for Quality for Health, you're sort of almost given like a supporting officer, and ours was Dorothea. And what was really helpful for us was she coordinated quite a few meetings for other organisations that had also signed up for Quality for Health, and we had quite regular meetings and shared sort of, well, we found this and we did this, or we found that if we did this, this helped us to do this. So it was quite good to share that sort of experience of what other organisations that were doing and we might not have thought of. And the other thing that was really helpful was the free training courses that VAC sort of offered. So they were really useful because our volunteers and staff were able to access those. Equality and diversity was an area that we were looking at for our delivery in Kirklees, and one of the things that we were conscious of was that our membership didn't quite reflect the diversity of the Kirklees population. So we were able to sort of work with Dorothea to, okay, how can we sort of work to sort of combat that? And although we know that you can't force somebody to come somewhere, we could, so we signed up with the BAME network. We worked with other organisations that were thinking, so we were able to then start thinking about, like, constructively what can we do to sort of engage those communities and harder to do each group. So